So what happens? People come in like this 37-year-old, and what was he complaining of, or what was going on?
Respiratory distress. He didn't have COVID either. He did not have COVID.
And how do we know that?
I took care of him. I have the same type of results from his chart as I do with my other patient.
It was like the day before intubation, he was fine on the rebreather.
And then they intubated, and then he got a pneumo, and then they put in a PEP tube, and then it's been shipped.
And now he's 37 years old and dead.
Because that's what I'm seeing, like all these negative tests, and they're putting them on these vents. Hopeful that they'll get it. They're being put on these COVID floor. Is murder.
I give you a name. I want you to remember the name. I want you to write it down. Think about it, because that's what this rest of this hour is all about. Erin Marie Olszewski. Erin Marie Olszewski. A military nurse working at the epicenter of the epicenter of the epicenter, which is supposed to be New York, Elmhurst Hospital, Queens, where we are told the most people are dying of COVID, 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 COVID. She's a hero, okay? She went undercover in the hospital with video camera, with audio, talking to nurses, talking to doctors, and she was interviewed at length, over an hour and 10 minutes. There she is on your screen. We've got 8 clips. We're going to play them. I'm going to talk about them. This is a major, gigantic smoking gun on what is happening. One piece of background. July 26, 2000, Journal of the American Medical Association, Dr. Barbara Starfield, revered public health expert at Johns Hopkins School of Public Health, published a review, Is U.S. Health the Best in the World? In it, she describes the following. Every year in the U.S., medical treatment in hospitals, including errors and what else would you call it? Mistreatment, result in 119,000 deaths per year, added up per decade. This does not even include deaths as a result of toxic meds or vaccines. Mistreatment, errors in hospitals. We're going to be talking about one of these now. Elmhurst Hospital in Queens, New York, supposed to be the epicenter of the epicenter. Play clip 1.
I am pulling up like their laboratory results. So if you look here, you'll see COVID-19 bioreference lab. Here are the test results. As you can see, 5/1/2020 at 17:16, not detected. They test for a second time, 5/4/2020 at 17:59, not detected. So both of those are negative. Scroll up to the top. This is my patient. They are on a vent and they are being called COVID-19 confirmed, droplet in contact and eye protection.
So this person is...
Okay, that's clip 1. You get it? Labeling people, even the people who by their own test, talked about that before, negative, no COVID, mark them COVID, stick them on a ventilator. That procedure we will discuss, very, very dangerous. It's called murder. Be with you after the break. We're back talking about a nurse, military nurse, undercover, Elmhurst Hospital, Queens, New York, the epicenter of the epicenter, Erin Marie Olszewski. Video camera in the hospital, undercover, for an extended period of time, not just once. Audio in the hospital. Basically, while being a nurse in this incredible scene there at the hospital, also being an investigative journalist. Interviewed on video. The video is up in several places now. It's at banned video. You've got to watch the whole thing. An hour and 10 minutes. I have been doing nothing but since last night. So we established COVID patients in this hospital. They come in, even by conventional tests, they test negative, 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 but they're coded as COVID-19. What do you know about that? That's what Erin documented, showed it in the first clip. What happens then? As she said, put on ventilators. This is very serious treatment. Cuomo, the governor of New York State, of course, was screaming about the need for ventilators, ordered 30,000 ventilators. What does he know about medicine, health, healing? Zero, less than zero. But of course, he's suddenly a medical professional and he knows everything, right? He's also the person who said hydroxychloroquine should never be used, refused to allow it to be used, finally said, okay, in a desperate situation, you can use it, et cetera, et cetera, et cetera. What's happening at this hospital? Play clip 2.
Reality.
I compare this hospital to a third world country. I've been in a third world country hospital in Iraq. The Iraq hospital is better than this one, and that says a lot. I've been there. I've been in both hospitals.
Play clip 3.
There are good nurses that work there too. Like, I have made good friends with a lot of the nurses that do work there. There's good people, but they're outnumbered.
So what happens? People come in like this 37-year-old, and what was he complaining of, or what was going on?
Respiratory distress. He didn't have COVID either. He did not have COVID.
And how do we know that?
I took care of him. I have the same type of results from his chart as I do my other patient.
It was like the day before intubation, he was fine on the rebreather.
And then they intubated, and then he got a pneumo, and then they put in a PEP tube, and then it's been shipped.
And now he's 37 years old and dead.
Because that's what I'm seeing, like all these negative tests, and they're putting them on these vents. Hopeful that they'll get it. They're being put on these COVID floor. Is murder. It straight up is. It is setting these people up for failure based on.
Okay, it's murder. It's murder. They put people on these ventilators that have no reason in the world to be on the ventilators. As you saw on the screen, young patient developed pneumonia. That is a serious medical problem that is understood very well in the medical community to be a problem associated with ventilators. So you don't use ventilators just casually, as they're obviously doing, by calling patients that test negative for COVID positive and putting them on the ventilators and killing them at the epicenter of the epicenter. It's murder. It's murder. Does the governor know? Does the president know? Does the mayor of New York know? Does anybody in New York really know what's going on at this hospital? Does anybody in New York in an official position really, really know what's going on at any of the hospitals in New York? So at this particular hospital in Elmhurst, they're generally serving the poor, Black, Hispanic populations. What about the elderly? Another, quote, demographic. What about the elderly at this hospital and other hospitals in New York? How are they dealing with them? Getting the message here, Erin Marie Olszewski. So imagine that you're a military nurse. You served tours in Iraq, as she has. You come back to the States. You're working, I think, originally Michigan, Florida, now up to New York. Okay. Suddenly, you're in the middle of this dire, incredible situation that you recognize is like being, it's worse than the hospitals that you worked in Iraq. What are you going to do? You're there. You're going to walk away. You're going to try to talk to people. She does that. You'll see if you watch the entire video. She talks to a doctor in the hospital, engages him in dialogue. His answers are quite revealing, and I would say typical and cold-blooded as to what to do, what can't be done, the attitude, and so on and so forth. What does she decide to do? Erin Marie Olszewski. She decides to expose everything that's going on and laying it out to the public and to any public officials that want to know what exactly is happening. Play the next clip.
Because they're all scared. Everybody's scared. And everybody's scared to stick up for themselves. And I've called a lot of doctors unethical to their face, and they deserve it.
Calling doctors unethical to their face, and they deserve it. You would think that when there's this explosion of people dying in this one area of Queens, New York, that somebody is going to say, maybe we should look at the hospital. Not just what's happening out there before they get to the hospital. How about we look at the hospital? Why don't we go inside the hospital and find out what they're really doing to patients there? That's what this nurse did. That's what is happening. She deserves every amount of support we can give her because she's put herself at great risk in many ways. We'll be back after the break. Don't go anywhere. We're talking about Erin Marie Olszewski, military nurse, Elmhurst Hospital, Queens, New York, who has gone undercover in the hospital with video, with audio, talking freely about everything that's going on in that hospital where people are being killed. It's murder. Play clip 4.
They're all scared. Everybody's scared. And everybody's scared to stick up for themselves. And I've called a lot of doctors unethical to their face, and they deserve it.
Okay, go on to the next clip.
And this is in the United States, and this hospital is treating low income, mostly people, and it almost makes me feel like they think these people are disposable, and they're not. They're people. You know, people are not disposable. You know, especially the ones that are struggling day in and day out, the hard workers, you know, like trying to reach that American dream, and they're not given a chance because they're brought to this place where nobody cares.
And is there an understood financial incentive to diagnose COVID?
Yeah, of course. So in the hospital that I'm in right now, it's all COVID at this point.
It's all COVID. Financial incentive to diagnose people with COVID. Their own tests are negative. They're diagnosed with COVID. And again, what does that mean? It isn't just a game they're playing to get money. It is that because the insurance payouts, as I've described before, are considerably higher when you have a patient come into the hospital and is diagnosed as COVID. We understand that. We're talking about something a lot more serious than that for the patient, which is they're put on a train from the point of the diagnosis in this hospital onto ventilators. Highly risky procedure. It's not just, put them on a vent. No. The people that are working these things have to know exactly what they're doing, have to be doing it for exactly the right reason with the individual patient if absolutely necessary. This is not a one-size-fits-all, as the nurse Erin describes here at some point in the video. And as you'll see, because we're leading up to this, there will be a section here where it's much worse than just the ventilator. There's more involved on this train to death and nowhere than just being put on a ventilator, which itself is dangerous enough. Using the wrong protocol, too much pressure on the lungs, collapsing the lungs, destroying the patient's life, etc. Pneumonia that leads to death, etc., from the ventilator. But there's even more. And I want to make sure that we get all this in. So go to the next clip.
In here, I guess the word traveled after this.
You mentioned earlier that this is a common occurrence where people come in able to speak and they just have low oxygen levels and they're put on a vent. So what's going on there?
I don't know. I honestly have no idea how. They're assuming everybody is just the same. There's no individuality anymore. These residents, I think a lot of them are just stone cold. There's no emotion, and they don't view people as people anymore. And it's really sad. I came a little bit later, after the big rush, but there was still a lot of people coming in, and a lot of us were just in shock. Within the first couple days, you could see exactly what was going on.
My bigger problem with this whole scenario is when they intubate people who don't need it.
Yeah.
And it looks very clear to me that they're just pushing it.
You almost feel like you are literally living in the Twilight Zone.
Living in the Twilight Zone, intubating people that don't need it, meaning putting them on ventilators when they absolutely don't need it. It's murder. Who cares in New York? Who really cares in New York? Tell you something else. I've also, I believe, reported this on another episode here on InfoWars. A trusted emergency room doctor, not at this hospital, another hospital, said, one of the things that these doctors now don't realize is that many elderly people live with chronically low levels of oxygen. Is it optimal? No. Do they survive? Yes. It's just what is happening to them as they get older, as they get diagnosed, of course, with multiple conditions and are treated with toxic drugs, et cetera, yes. They survive. But they come to a hospital like this, which, as Erin says, the residents there, they're not working like true professionals that are really competent and understand from experience what's going on. So what does low oxygen in a patient look like to them, in an elderly patient? Put them on a ventilator, put them on a ventilator, put them on the train that leads to the ventilator, that leads to pneumonia, that leads to wrong protocol, that leads to too much pressure, that leads to collapsing of lungs, that leads to pneumonia, that leads to death. Put him on that train because he's an old or she's an old person who has chronically low levels of oxygen but manages to survive year to year, decade to decade to decade. But they don't recognize that. They don't see that. They don't know that. They have no clue. Who is educating these people? Who is responsible for that? And where are the investigations of all the hospitals in New York, dealing with all the people and what is really going on in these hospitals, not just in Elmhurst? Play the next clip.
What killed him? Did the vent kill him?
Yeah. Oh, yes. They're so sedated. He had probably 8 or 9 drips. It's all sedation. It's all sedation and paralytics. So you are asleep. It is essentially like you're under, you're in surgery, when they put you under like that for a good month straight. There's no way you can recover from something like that. You'll be brain dead if you do.
That's the key clip. That's the key clip right there. That's the one that needs to be expanded, elucidated, explained, stressed, laid out in full. What she's talking about there is not just the fake COVID diagnosis leading on the train to the ventilator. And she's not just talking about the patient being given a light muscle relaxer while on the ventilator. Play that clip again.
What killed him? Did the vent kill him?
Yeah. Oh, yes. They're so sedated. He had probably 8 or 9 drips. It's all sedation. It's all sedation and paralytics. So you are asleep. It is essentially like you're under, you're in surgery, when they put you under like that for a good month straight. There's no way you can recover from something like that. You'll be brain dead if you do.
We'll explain that in detail after the break. Stay with us here on InfoWars. Jon Rappoport back here. The last segment this hour. Okay. What you saw in the clip just before we took a break there was it's not just a ventilator. It's the ventilator plus heavy, heavy, heavy sedatives. She was talking about somebody who was on 8 or 9 different drugs. They put you to sleep on the ventilator for a long period. That's what she was saying. You don't wake up. How do you like that kind of death? Somebody tests negative even on their own tests for COVID, comes in the hospital. Maybe has low oxygen level, whatever. Oh, must put him on a ventilator. Put him on the train to the ventilator, to the effects that I've indicated earlier in the segment, pneumonia, et cetera, wrong protocol, lung collapse, et cetera, whatever. Sedative, massive sedation. The person never wakes up under a ventilator, sedated, isolated, no friends, no family permitted, dies. If you were the mayor of New York, de Blasio, if you were the governor of New York, Como, wouldn't you be interested in knowing how often that happens in your city and your state? Wouldn't you be interested? Wouldn't you demand that this be discussed and investigated and prosecuted? Wouldn't you? What about you reporters in New York? Don't you think this is a story? Don't you think you should be camping out in that hospital and at the governor's office and the mayor's office, demanding for once in your life, demanding that you get answers, that you want to know what's happening and why this is happening on the train to death in the epicenter of the epicenter? Don't you think that might be important enough to get up off your ass every day and do the job that you're supposed to be doing as a reporter and a journalist, much less a governor and a mayor, instead of harassing your own citizens and driving them to despair by insisting on massive lockdowns when lockdowns are absurd and counterproductive, and you know it by now, and you're lying through your teeth all the time, all day, all night? Mr. Mayor, Mr. Governor, don't you think it's time to lay it out and speak the truth for once in your life, even if it involves admitting what you did when you insisted, Como, there had to be 30,000 ventilators immediately put into New York when you said that hydroxychloroquine could not be used except in the very late stages and so on and so on and so forth? Or are you just going to sit there and let this all play out? The endless amounts of economic destruction, the health destruction. Play the next clip.
It's the same reason they won't use like other treatments that are successful around the world. And I had a conversation with a doctor about this.
Are you guys doing like different sorts of like treatments? Because I know like
nothing works.
They have, yeah, but I mean, there's, you know, they're coming out with different things that are in the testing phase.
It's the same thing they come with a platinum that kill more people than actually save. So that's one.
And he said that they don't work anyway. And I told him, well, obviously what you guys have going on here isn't working. So what's the harm in trying?
I don't expect any of these people to survive. 90% of them would die.
I mean, it's just maintaining. So I figured if it's assumed they're going to die anyway,
just try.
Why not throw a few?
Well, it's, you know, I don't know. That's always an issue in medicine, whether you should just throw things, whether they're dying anyway or not.
But if you could find a cure.
Well,
I mean,
there's no
like
cure, so there's no antiviral therapy. The only way to do it is cure, but there's no
treatment, I should say. Rephrase. Treatment.
You could treat it, but you know, you have to have some scientific basis for whether these things are working or not. And just throwing everything at them, you could make them worse. So
worse than death.
Huh?
Worse than death.
Well, we said 90%, maybe that 10%, maybe they're true. I don't know.
Yeah.
But I mean, if there's no basis for it working, I mean, you wouldn't just try things just because. I mean,
I would.
I might.
If it could save my life. Yeah.
She says, I would try to save my life. And you'll see when you watch the entire video at Band Video, she's talking about hydroxychloroquine plus zinc. She's talking about injections or IV of high-dose vitamin C. She mentions this to the doctor. The study that was done, he just passes it off of no concern. You know, what do we care? And why? And she's saying, well, why not try something? If death is the alternative, don't you think a rational or sane doctor would say, well, let's try something? Because we know the alternative is something called death. But no. What difference does it make? What use is it? This is a doctor. This is actually a healer of some kind. Not any kind that I've ever known about. It's actually a healer. With that attitude, sounds very dangerous, in fact, to me. Extremely dangerous. Extremely dangerous. You got to watch the entire 1 hour, 10-minute video. Erin Marie Olszewski, military nurse, been a nurse for many years, in the military, in civilian life, goes to the epicenter of the epicenter, and eventually, because she's horrified at what she's seeing, decides to do something that very few people would do while still working there. A camera in her glasses, undercover, day after day, audio, video, gathering information, and then having that interview and just laying it out there completely as to what's happening, the whole story. Not many people would do that. Deserves every possible support that we can give. It's just amazing. Just amazing. I don't know what else to say about it. It's all laid out. Where are the public health authorities in New York? Instead of yammering about this and that, and you got to wear the mask, and you have to keep the distance, and blah, 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 blah. When the health agencies themselves even admit, And mainstream people who are educated in that kind of science, epidemiology, readily say this whole thing has been completely politicized. Fauci is just a front man. Why is he there being the spokesman for the epidemic? Why? Because he's on television. That's why. Because he wormed his way up to that position. It has nothing to do with knowledge or science or credentials. You know, some idiot like this interviews him and this idiot talks and everybody watches on television. And suddenly, I love Fauci. Is he wonderful? He's the only guy that makes any sense. Yeah, that's because you're deranged that you think he makes sense. Instead of having somebody that actually makes sense. Look up Scott Atlas, California. He makes a degree of sense. Look up the leaked German study out of the Interior Ministry that said the whole thing is a false alarm. Even within the conventional picture of this whole epidemic, with all of the focus being on the lockdown, which means the destruction of human life and destruction of economies, which is the purpose behind the whole thing, to bring on the vaccine and to destroy economies and to create the new normal for everybody and never go back to the way it was. There's murder happening in New York. There is murder happening in New York Hospital. Governor Cuomo, de Blasio, public health authorities. Find it. People are not going to be appointed by those idiots to do a real investigation. You're going to have to do it yourself and find out what's really happening. Watch the video. Watch the whole thing. I played 8 clips here. You've got a flavor of what this is about. There's a lot more. Thank you, Erin. Appreciate your work. Stay well.